Hi, I'm Dr. Greg Malsberg. I'm a psychiatrist and multimedia editor-in-chief at Carlat. This is an article recap from the Carlat Psychiatry Report. Today we're diving into Buspirone, a medication with a long history and a unique role in psychiatry. Often overlooked in favor of faster-acting alternatives, Buspirone offers a tolerable and safe option for generalized anxiety disorder. Check out a link in the description for a helpful fact sheet on this medication. Let's dive in. How does Buspirone work? Buspirone's in a tiny class of medications, the azapirones. Initially developed as an antipsychotic, it found its niche as a treatment for generalized anxiety disorder. Its primary mechanism of action is partial agonist at the serotonin 5-HT1A receptor, a feature shared with other antidepressants like vilazodone and antipsychotics like aripiprazole and quetiapine. Buspar also has mild dopamine antagonism and noradrenergic effects, though these mechanisms are less understood. This combination gives Buspirone its distinct profile, effective for anxiety without the cognitive or dependency risks of other medications. What can and can't Buspirone do? Buspirone's FDA approved for generalized anxiety disorder, but how does it compare to other treatments? Its effectiveness in generalized anxiety disorder. A meta-analysis found Buspirone's effect size here to be 0.17, smaller than the SSRIs, 0.36, or the benzos, 0.38. However, head-to-head trials show that patients switching from benzos to Buspirone perform just as well. Its advantages lie in its lack of dependence, withdrawal, or abuse potential, as well as no impairment of cognition or fall risk. Augmentation in depression. While it's often used as augmentation strategy in major depression, Buspirone ranks below other options like lithium, antipsychotics, and thyroid augmentation. That said, it worked well in severe depression in a large randomized trial, and its tolerability makes it worth trying when side effects are a concern. Special populations. Buspirone may relieve SSRI-induced sexual dysfunction and bruxism. It has shown benefits in premenstrual dysphoric disorder when used continuously or in the luteal phase at 10 to 30 milligrams per day. Buspirone may reduce irritability and aggression in conditions like dementia, TBI, and ADHD. Limitations. Buspirone does not work for panic disorder, social anxiety, or OCD, and it hasn't proven effective for addiction treatment in alcohol, cocaine, or nicotine dependence. How and when to use Buspirone. Buspirone is ideal for patients who need a tolerable treatment for generalized anxiety, particularly those at risk for medication dependence or side effects. It can also be considered for augmenting antidepressants when tolerability is the priority. Dosing strategy. Start with 5 to 7.5 milligrams twice daily and increase to 15 milligrams twice daily over the first week. Allow 2 to 4 weeks at this dose to assess efficacy. Then titrate it as needed up to 60 milligrams per day. Some clinicians go as high as 90 milligrams per day. Some tips for use. Buspirone has a short half-life, 3 hours, so 3 times daily dosing is optimal, but twice daily dosing can be effective and more practical. Taking Buspirone with food doubles its absorption and reduces nausea. Be cautious of drug interactions. It's a substrate of CYP3A4, so adjust for inducers like carbamazepine or inhibitors like fluvoxamine. Rarely, Buspirone can induce mania in patients with bipolar disorder. What's the Carlat verdict? Buspirone is a first-line option for patients who need a tolerable medication for generalized anxiety without tolerance or abuse potential. While it's not the strongest choice for antidepressant augmentation, its safety and tolerability make it a valuable tool in select cases. Thank you for watching this recap. For more insights into psychiatric treatments, visit the Carlat Psychiatry Report at thecarlatreport.com. I'll see you next time.